So this year we've noticed a weakness develop in Dan's arms, most particularly in the left side, and particularly in the left forearm and hand, where there's been obvious muscle wasting. And he's been to a neurologist who's done multiple tests, including MRIs, which shows that he's got a rare condition called Hirayama disease, and that's a disease or a condition affecting the spinal cord. So if we think of the spinal cord as this tube, and that's got the spinal column around it, the bony part of the spine surrounds it, but the spinal cord also has a sac called a dural sac engulfing it like that. So when we bend the neck forward, normally there's enough slack in that sac to not cause any problems. But with Hirayama disease, it's thought that the spinal column, the bony structure, grows faster than the spinal cord, or more specifically that dural sac, and so that dural sac becomes tight. And then when we bend the neck forward, that increases the pressure of the dural sac pushing on the spinal cord, squeezing it up against the front of the spinal column, which affects the circulation in the cord and results in damage to the cord, which causes the weakness in the arm or arms. In terms of management, surgery is not really appropriate on growing kids. So a neck collar like that you need to wear sort of 24/7, because you basically need to stop bending the head forward for the next 4 or 5 years. Rotation's fine, looking up's fine, but just not bending down, because that causes that dural sac to push forward and squeeze the spinal cord against the spinal column. Now, the specialist says he's allowed to keep going with his water sports, provided his condition remains stable. But this collar's not much good because it's open cell foam and it's too floppy. So we've made another sort of a collar to give him more support. And so his grip strength in the left is about 25% of normal. And we've got some video we've taken recently of him getting back out in the water, and it's interesting to see that he can still manage to do pretty well even with that sort of strength, which is really encouraging. He hasn't done much windsurfing. He's only done about 15 minutes of windsurfing so far, and that might be a little more challenging because his passion is wave riding, which means unhooked, and that's going to be a little bit tougher. But hopefully with warming weather, he'll get a bit more strength happening. After 4 or 5 years, it's called a self-limiting disease, presumably because the dura mater grows and catches up to the spinal column surrounding it. So then neck flexion shouldn't be a problem. So he hopefully won't need to wear a neck brace after that. He will have sort of long-term weakness in his arm because of the damage to the spinal cord is broadly permanent. But hopefully with some exercises he can pick up his strength, which should hopefully help. So we've got some video of him getting out recently, just to see how he's going with his new neck collar.